Yeah, one thing I heard from a community practice colleague who treats multiple different types of cancer, who's been at this for longer than I have, he had this analogy with a patient who came in and they really wanted chemotherapy right away. They were waiting for molecular testing, which would inform what we do, but they have this cancer in them right now and they don't want to wait. So the way he counseled that was saying, right now, your cancer isn't a medical emergency, but I appreciate that it's an emotional emergency. So, like that decision to wait versus let me just go find someone who's going to do something
Mhm.
is a really, really hard decision to make. And I think right now, we're in an area in this field where people have access to do more and more and more things. And that gives us sense of control and it gives us, I don't even know if it alleviates anxiety, but I do know it's not always good.
Yeah, right. Doing something feels good, but it isn't always the right answer, especially in the context of cancer. Like it's really hard to recognize that waiting for results or waiting on whatever it is that's been recommended is potentially the right step for you. And I think that goes back to an anxiety reduction technique we'll talk about a lot is having trust in your treatment team and making sure you do have that relationship with them. And also this concept of, in some ways, kind of being the CEO of your own healthcare. That doesn't mean that Kyle's opinion isn't important. It's just that he and maybe other opinions you have and what you know about your body come together, and you're the one that ultimately has to make the decisions and feel good with those decisions at night, which can be just a really helpful way to mitigate a lot of stress in the cancer process.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.